Hello, and thank you for joining me today. Today I will be talking about the nurse shortage that we're experiencing here in Florida. As of February 2016, there were over 12,500 nursing vacancies throughout the state, with that number expected to increase significantly over the next decade or two. So we'll be talking about the causes of that shortage, the consequences of the shortage, as well as some strategic solutions to potentially reduce that shortage. So first of all, in causes, the population of Florida is growing at a very fast pace. It's one of the fastest growing states in the country, and the population of Florida is aging quite rapidly as well. It does have more individuals age 65 or over than any other state in the country. The workforce of nurses in Florida is aging as well. Many people are starting nursing later in life and working into their later years. So we need to try to figure out how to get more younger folks to get into the workforce and stay in the workforce longer as well. Uh, Also, with the passing of the Affordable Care Act several years ago, that has increased the number of insured individuals, which generally, if people are insured, they usually are more likely to pursue having some kind of medical procedure done, which increases the need and demand for nursing professionals. So just the number of people needing care has increased. Obviously, that requires more nurses as well. The technology in the healthcare field is advancing at a rapid pace as well, and that requires a lot of specialized experience that can sometimes be difficult to attain, especially if you're already in the field and you're just going about your normal job. It's hard to get that specialized training. Another cause that is happening for nursing is the education capacity is uh, not enough to help get people in the field quick enough. Almost 80,000 individuals were turned away that were qualified just because there simply wasn't enough capacity to accommodate them. Uh, what is this causing in the field? Well, when you have fewer nurses, the speed of the care that you're receiving generally slows down. If you have one person doing the job of three people, that one person is pulled in many directions and simply can't uh, provide the care as quickly as if there were sufficient nursing staff. The quality of care, unfortunately, can suffer as well uh, when somebody is overworked and they're having to make quicker decisions and maybe they're tired as well. Sometimes those decisions may not be the best decisions. So the quality of care, unfortunately, can become an issue. Um, so, and also the cost of care can increase as well. Um, Having an individual stay in the hospital longer than is necessary produces many additional costs for not only the hospital but or whatever facility it is, but also the patient. The patient's obviously the one who's ultimately going to be paying, or potentially government as well. But those costs increase significantly the longer somebody is actually in the hospital. And of course, a major consequence also of a nurse shortage would be simply the burnout of the nurses that are already in the industry. They're overworked. It's a very difficult job, and it can be very difficult, and they just get burned out, and many individuals end up leaving the field. So, what are some solutions to potentially mitigate the shortage? Well, many of them come down to money. Uh, you can always offer individuals more money to get into the field and provide an incentive to start a nursing career. Florida, unfortunately, is not one of the highest paid states. In fact, it's middle of the road, if not a little bit below average. So that is something that needs to be addressed. Some other possible ideas would be higher sign-on bonuses to try to attract nursing individuals, possibly even from out of state. You could even offer some kind of a relocation stipend, as well as loan forgiveness programs, and also earn as you learn programs where organizations could potentially pay for your education, with, of course, the stipulation that you work for that facility for a certain number of years to kind of repay the investment. Also, specialized training on can be accomplished for more people by potentially offering, if let's say there's 120 hours of training available for some specialized equipment, just train more individuals for a shorter length of time as opposed to fewer individuals for a longer time. So for example, if you had 4 individuals getting 30 hours of training as opposed to 3 individuals getting 40 hours of training, you'd have 1 additional person that is potentially ready to be released into the field. So those are kind of that's the issues that we're encountering and some of the problems that we're having with the nurse shortage. And so we have some challenges to work with, and those are some of the possible solutions. Thank you.